48-year-old Amy is like any other Singaporean. Her life follows a routine of work, leisure and family. But what makes her different is the story behind the smile.
I thought you like this one. I thought you like this one.
She is living through one of the world's most terrifying illnesses. Amy has stage 4 breast cancer.
Once cancer recurs, we term that as stage 4 breast cancer. Besides having the breast and lymph nodal involvement, there's already cancer that's seen in the lungs, in the liver, or in the bones. Traditionally, in the past, or rather historically, the survival rate of stage 4 breast cancer is quite dismal. The 5-year survival ranges from about 4 to 5%. In other words, only about 4 to 5% of the patients will be alive at the end of 5 years.
I was very, very sad, and all sorts of thoughts came to my mind, and especially I was very, very worried, and I really cried like mad. This relapse, it was stage 4, and I was thinking, will I be cured or not?
Breast cancer is the most common cancer amongst women all over the world. In Singapore alone, every year, about 1,100 new cases are diagnosed. That's an average of 3 women being diagnosed with breast cancer each day. According to the World Health Organization report in 2005, more than 500,000 deaths worldwide are caused by breast cancer.
We don't have a family history of cancer, especially breast cancer. And because the doctors asked me some questions about my lifestyle. So I don't drink, I don't party, I don't smoke, I exercise, and I'm very conscious of what I eat. You know, so I was thinking, why of all is me?
The disease doesn't choose its victims. The selection almost random. That's why doctors have long urged women to have a lump checked once they detect that something is wrong. Research has shown that there is a 90 to 95% chance of survival if the cancer is detected early.
There are many reasons why some women are not forthcoming in screening, in coming forward for screening. Some of them is self-denial. They say that if they do not find it, they will not have it. Some would prefer not to do it because they heard so much about mammogram causing a lot of pain when the procedure is done, so they rather not do the mammogram.
The usual advice is that women above the age of 40 should go for an annual mammogram till they're 59. Yet increasingly, younger women are battling with the disease, a phenomenon largely blamed on the modern lifestyle of women. Doctors say that a lack of exercise and an unhealthy diet are contributing factors to the increase in numbers. Amy found a lump in her right breast in 1999 through self-examination. She went to the doctors to remove the lump and realized that she had stage 1 breast cancer. She was only 39 then.
The problem with breast cancer is that the cells tend to migrate, tend to spread to other organs, and one of the first places cancer cells spread to is the lymph nodes. And the lymph nodes, the cancer cells basically follow the lymphatic channels where body fluid flows to the lymph nodes and migrate directly to the lymph nodes.
So 2 weeks later, I was scheduled for the operation. And when I wake up, I felt that there are bandages at the armpit, the right side of the armpit. Straight away, I know that it is cancer.
For Amy, the good news was that she needed only a lumpectomy, the removal of the lump and the surrounding breast tissue. This meant that Amy could retain both her breasts. Lumpectomy is also known as breast conservation. Now, more than 50% of women with breast cancer are diagnosed early enough to have the option of breast conservation.
The biggest movement forward, and it's been for the last decade or so, is the increasing use of what we call breast conservation, in which you can safely treat a cancer without completely removing the breast. And of course, when you remove the cancer from a breast, you must leave the lady with a good enough aesthetically appearing breast that is safe from the cancer point of view.
Unlike Amy, Noor Kama entered the operating theatre knowing that she had a confirmed stage 2 breast cancer. Her message to the surgeon was simple: remove the entire breast if necessary. And that was exactly what the surgeon did as she lay on the operating table. Yet, Noor Kama woke up to find that both her breasts were left intact. For breast cancer patients, surgery is usually recommended for the earlier stages. Following the removal of the whole breast or a mastectomy, patients can now opt for a breast reconstruction, a good option for the modern woman. This involves filling the breast skin with tissue from the lower abdomen or back, or with an implant. Yet it also means that patients have to come back for the surgery after their wounds have healed. In recent years, doctors have found a way to circumvent this.
Today, with better reconstruction techniques, we are more able to offer what is considered immediate reconstruction. That means when we remove the breast at the same time as surgery, we actually reconstruct the breast. And the recovery time is actually no longer as long as it used to be.
Now women can wake up after only one surgery to a fully reconstructed breast that is aesthetically balanced with the remaining one. It proved to be a great option for the self-esteem of the young Noor Kama. In 2004, she decided to have a mastectomy and a breast reconstruction in the same operation.
Maybe when you're young, so I will feel that, you know, when you wake up, then you find that, when you see in yourself, then you say like you're like imbalance things. So it's just for my own self, because I more years to go. Then I feel that maybe it's better that I have these reconstructions on the breast things. Then I won't feel so bad and won't feel so depressed.
During the surgery, however, the surgeon had removed all her lymph nodes because he wasn't sure if the cancer cells had spread beyond the infected area. He didn't want to take any chances, even if there were minor repercussions for Noor Kama after the operation.
When a person has an axillary clearance, 20% of women will have permanent swelling of the arm, and that's due to fluid retention. It's not life-threatening, but it's a bit of inconvenience for the patient, and that's long term. The other problems that can occur are susceptibility of the arm to infection, stiffness of that shoulder, and numbness in the underarm area, which is permanent as well.
The side effects that I'm facing now is that I cannot carry heavy things. So we were told that you cannot carry more than 5 kilos. Then I must really take care on my left side, that's where my lymph nodes being removed, that no blood pressures to be taken there and no drawing of bloods or needles to be poked onto that side.
Whatever measures we do to prevent...
Only 1/3 of breast cancer patients will have affected lymph nodes. In 2005, shortly after Noor Kama had her lymph nodes removed, a new technology called the sentinel node biopsy was introduced in Singapore. It is the testing of the first lymph node in the cluster, and what this means for patients is that the other lymph nodes do not have to be removed unnecessarily. Long-term inconveniences became a thing of the past.
To locate the sentinel node, we actually need a tracer, because sentinel nodes actually look exactly like any other node, and they don't occur in the same fixed position for all patients.
Two tracers are used, a radioactive tracer and the other is a more widely used visual tracer. A blue dye is injected under the skin at the time of surgery. 10 to 20 minutes later, the sentinel node will appear to the naked eye. This blue stain node is the first in the chain of lymph nodes. It is removed and a quick biopsy is done immediately by a pathologist to determine if the cancer cells have migrated beyond the breast. Once the results return, the surgeons will perform the operation and remove any cancer cells.
After the surgery, there will be other treatments as necessary depending on the stage of the disease, depending on the characteristics of the cancer. These treatments are what we call adjuvant treatments. Adjuvant treatments are treatments that are delivered after a surgery has been performed with the intention of reducing the risk of recurrence. Not everyone has the same risk of recurrence. The risk of recurrence is determined by the size of the tumor, the characteristics of the tumor, the lymph nodes that are affected.
Having breast cancer is no longer a death sentence in this day and age due to the improvements in treatments. Surgery is the first option for the earlier stages, and follow-up treatment or adjuvant treatment is prescribed to remove any remaining cancer cells. Though the treatments differ for patients, targeted therapy and newer and better drugs have helped many women. In the United States alone, 9 in 10 women survive due to these improved drugs.
There are newer treatments we call targeted treatments. These treatments have much more specific targets in the way they kill the cancer cells. Because they are more specific in the way they kill the cancer cells, they do not affect as much of normal cells. So therefore, they have less side effects. Take for example a drug called Herceptin or trastuzumab. This is a drug that targets a specific molecule on the surface of breast cancer. About 25% of breast cancer has a lot of these receptors, and in these cancers, the drug Herceptin is effective. So the Herceptin has been used in treating advanced cancer, and they have been shown to prolong the survival of these patients. Equally, Herceptin has also been found to be useful in treating early breast cancers, which are HER2 positive. That's to say that they have many of these receptors on the surface of the cells.
These drugs, however, don't come cheap. A year's supply of Herceptin costs almost $50,000 US. And Singaporeans are still in the infancy stages to cope with mounting costs of fighting illnesses like cancer. Research has shown that close to 30% of Singaporeans are still not prepared for a rainy day. And this might turn out to be a potential problem.
Financial planning for medical care is important because as we've seen many advances that have come online, but many of these newer treatments do not come cheap. In fact, they are quite costly compared to what the treatments we have in the past. So it's important that one plans their health insurance carefully to make provisions, when there's a rainy day, when a disease such as cancer were to strike, we are well prepared for it, so that we will not be limited by the kind of treatments that we receive purely because of financial reasons.
Noor Kama went through 6 months of chemotherapy and was given a clean bill of health. It's been 3 years since her cancer struck. She has 2 more years to go before she can be declared cancer-free by the doctors. But Noor Kama remains positive about the future.
I always tell myself that no matter what stage I'm in, then I know that I don't know when these cancer cells will come back. You see, it's like nobody will know also. So what I need to do now is like have to really take care of myself have a good, healthy lifestyles, and then watch whatever I eat, and then I do a normal, regular exercise things, and like really take care. So hopefully that in futures I will not face again what I have faced in the past.
For Amy, things were different. Her cancer cells struck back, this time in full force. She had a first relapse in 2003, 1 year shy of her 5-year mark.
When Amy saw me in 2003, in actual fact, she had already completed an initial treatment in 1999, and this was a cancer recurrence. There was disease that was seen in the lungs, there was cancer that was found all over the neck, indicating that this cancer, in actual fact, had recurred and spread to other organs.
Amy was prescribed chemotherapy and hormonal pills for 7 months. She managed to arrest the condition in 2004. But the cancer cells were only lying dormant, waiting. A few months later, her condition worsened. This time, her chemotherapy dosage was increased, bringing her to an all-time low.
I pray a lot to God that please lessen the pain and the discomfort. And there are some nights I tell myself, why I have to go through all these again and again? And when can the cancer be controlled? Then I don't have to go through all this treatment anymore. But there's never a day I give up, because there's always hope there.
Amy pulled through the ordeal. Even though she went through a third cancer recurrence in 2006, her cancer is now in remission.
Any problems, anything you want to report?
This past few weeks, my fingers seems to be very stiff.
And not to worry, probably just water retention.
Okay.
I can give you some medicine to reduce the swelling. For Amy, her cancer was not responsive to hormonal treatment. She, in actual fact, she has a very chemo-responsive cancer. Each time you give her chemotherapy, the disease melts away and she goes into a remission. Her cancer at this present time is in complete remission. There is no cancer that you can detect clinically. All her blood tests are normal, and on the scans, there's no evidence of cancer.
It's been 5 years since Amy has been diagnosed with stage 4 breast cancer. She no longer needs to go back to the hospital for chemotherapy treatment, but now carries a chemotherapy pump with her wherever she goes to keep the disease in check. The device releases a small dose of chemotherapy into her body every 24 hours, and she has to change the pump every week. But this helps her lead a normal life every day.
I still go to work. I do things like what normal people do. Like I still do housework myself. I does marketing. I do light exercise. I still do those stuff which normal people do. I never let cancer control my life. I believe God will take care of everything. So I leave it to God. If God think that my time is out, my time is out. If God think that, okay, you can live another few more years, then of course I'll be very happy to live for another few more years.
Many people believe that cancer is a death sentence, and for stage 4 disease, it remains incurable. That's true. But many of them do not realize there are actually options of treatment that can give them a reasonably good life, a good quality life, in spite of having stage 4 breast cancer. And what is not available today may be available tomorrow. But in the last 2 decades, there have been many advances with newer drugs, newer ways of treating these cancers. And the survival of breast cancers, 5-year survival, can be as high as 30 or 40%.
To me, there's always hope, so long as you get yourself treated. And the mind here is very important. Must think positively, never give up hope. Hope to me is being able to wake up every morning to see sunshine. Hope means every day to me is a new life.